Hi, I am Mrs. Sloan, and this is a video intended for my honors biology students. This is video number 3 on lymphatic system and your immune response. Sorry, that's my dog. So video 1 was all about an overview of the lymphatic system, including a discussion about your innate immunity, that immunity that you are born with. In video 2, I discussed your adaptive immunity, and this is immunity that you need to have in order to get rid of a pathogen using things like your B cells and your T cells. And we discussed what triggers them and how they work. And then now here in video 3, we're going to talk about induced immunity, like using vaccines, for instance. And we will also discuss adverse effects in your immune, with your immune response, things like allergies. And we will also talk about disorders of the immune system. All right. So if you need to review, I would watch video 1 for innate and video 2 for acquired or adaptive immunity. And here we go. I'm going to make myself a little bit smaller. My dog has a squeaky toy, and he is squeaking it. All right. So let me go here, and I need a pointer. All right. So in my videos, in the descriptor down below, you will see a copy of my the notes that I give my students, the group shared notes. Column 1 is the scaffolding. I'll help you fill that in. And then column 2, I encourage my students to put in pictures and images that help them. On those notes, since we've already had a couple videos on that already, we are on 13.3, active versus passive immunity. That's where we're going to pick up. But I want to do a very quick review with you, comparing and contrasting in your acquired immunity or adaptive immunity. Remember, you have your antibody-mediated response and your cell-mediated response. You need both of these to be triggered so that you can fight off the infection. So your antibody immune response, this is B cells, and they will either make plasma or memory cells. And plasma cells are going to make antibodies, which will mark free-floating viruses, bacteria, pathogens in your body and in your body fluids, and mark them for destruction. Okay. It also will take a virus and inactivate it so that it cannot get access to your cells if it is tagged with an antibody. Whereas your cell-mediated immune response, those are your T cells, their targets are our own body cells that are either have gone cancerous on us, they've gone rogue, or they are infected with a pathogen. And so even though those cells belong to us, we need to attack and destroy them, and that's through cell-to-cell combat. So along with cytotoxic T cells who actually do the combat, your cell-mediated immune response will also make memory cells for a faster response on second exposure, and helper T cells to kind of coordinate the immune response. All right, so I want to make sure that's in your head before we start up today. So induced immunity, it could be naturally or with a little help. Now, let me tell you what I mean by naturally. Naturally is somebody with COVID could cough on you because they're not wearing a mask. You could inhale that, and then it could attack your body. And you know what? You will get sick from it potentially. And as a result of that, your virgin B cells and virgin T cells that can recognize COVID, they will be triggered, and you will start to develop memory cells. But that's going to take 10 to 14 days for that to occur, to build up that clone army of B and T cells that can fight that infection. So that's why you'll get sick throughout that, or possibly get sick. That would be naturally. Then in the future, if you're exposed to the COVID virus again, a second time, you will have memory cells that can respond. So that's naturally. With a little help would be something that my husband and I did. We went and got a COVID vaccine. Now remember, the COVID vaccine is not giving me the COVID virus, but remember, a virus has a nucleic acid for sure and a protein capsid. What the mRNA virus is giving you is the instructions, the mRNA instructions for the capsid, for the protein, for the outside of that virus, COVID virus. And so that way, if I'm exposed to that, which is harmless, right, other than the inflammatory response you will get in any foreign object in your body, which that vaccine would be considered a foreign object, right? I will have the inflammatory response of my innate immune response But I will also hopefully find the virgin B and virgin T cells that I needed to find to activate them so they will form memory cells. So if I am ever really exposed to the COVID virus, I will have those memory cells and I will have a faster response. Our immune systems, and this is my husband and I getting shots, our immune system needed to learn about COVID, and I didn't want to get sick from it, and that's why I got the vaccine. When I was a little girl, I got a polio vaccine. You know why? I didn't want to get polio because you can't have a little polio. You could have a leg that becomes paralyzed, and yes, you won't get polio again because you'll have those memory cells, but I now have a paralyzed leg, right? So I didn't want to risk that. So that's why we get vaccinated. So we're going to talk a little bit about that. I need to build up as many memory cells as I can to protect myself from any future infections. So immunity. Your innate immune response, remember, this is what you're born with. You remember these guys are really tiny over here, but there's some neutrophils and there's some macrophages and dendritic cells and mast cells, right? That's all part of your innate, what you're born with. But if you ever want to actually get rid of some sort of pathogen like what you're seeing here, you need to have your acquired immunity stimulated. So one way would be to make your own antibodies, and you could make them two different ways, right? I could make my own antibodies by natural exposure. Somebody could sneeze on me and I could end up getting COVID in that way. Now, I will get sick because it takes 10 to 14 days. Or I could get, which is what I did, I got immunized with it. So you either get a weakened version of the virus or a portion of that virus, so it triggers your immune response. So on your notes, on active immunity, you can be exposed to the antigen, and you can develop B and T cells that will fight the infection and memory cells for future encounters. And instead of being exposed to it naturally, you could also do it artificially, can be induced by vaccines, which is a weakened version of that pathogen or a part of that antigen. Now, sometimes you need antibodies right away. You don't even have time for a vaccine against it. And it could be like if you had snake venom, right? You don't have time, boom, you need antibodies and you need to borrow them. That would be artificial antibodies from another source. This could be a gamma globulin shot of antibodies, which will mark all the antigens and disable them. Okay, another form of passive immunity is through breastfeeding. When a woman breastfeeds her child, whatever antibodies are in the plasma of her blood do cross over to the baby. So now this baby has the same antibodies as their mother. Now, do they have their own natural antibodies and will they develop any memory cells? No. Both of these situations are short term. Okay, but as the baby is exposed to antigens, then it will start to develop its own active immunity over time, but it's blanketed with the care of mother's antibodies for that time when it is breastfeeding. So on passive immunity, it is short-lived because it is borrowed, right? You don't have any memory cells. That's what you want to remember. You just have the antibodies. You're borrowing another's antibodies when a person is in immediate danger. You do not develop any memory cells. And examples, like I said, was breast milk and a gamma globulin shot with antibodies. All right. Now, we addressed this in video 1 and a little bit in video 2, I think, but I want to remind ourselves about some of the cytokines. And these are how cells talk to one another. Remember, cells, they can see one another. They can either touch one another through a receptor where they're coming in contact directly with another cell, or a chemical is released by one cell and there is a receptor either on the surface or internally. So that's how cells can communicate with one another. So on how cells talk to one another, on number 1, defined signaling molecules produced by either lymphocytes, monocytes, or other cells. So lymphocytes are B and T cells. Monocytes are what develop into macrophages. Remember how they pull the alarm and say, hey, we got a problem here, right? And this can stimulate white blood cell formation, Now, there's a couple chemical signals. One type of cytokine is called interferon. And interferon is released by viral infected cells. So when your own cells are infected, they will release this interferon as a warning to neighboring cells to protect themselves against that virus. So interferon is released by virus-infected cells as a warning to protect other cells. There is another message, interleukins. This is another cytokine, and this amps up the inflammatory response, the swelling, right? And this will stimulate B and T cells. So for interleukins, released by immune cells to stimulate other immune cells. So a monocyte could release that when it pulls the alarm. So if you're trying to decrease the inflammatory response, then you would want something that would block those interleukins. So interleukin antagonists, which means against, may help prevent organ rejection, autoimmune diseases, and certain allergies. So cytokines, like I said, chemical communication, you want to remember that. Okay, and interferon says, I'm infected, save yourself, right? And interleukins are saying, fight, 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 fight. So interleukins encourage and increase the fight, and interferons are saying, protect yourself. They're more the defense, where this one is the offense, all right? Okay, allergies. Now, I don't know if you suffer from allergies. I have a son, my youngest son, who's 20 something, 3, I think. He would get terrible allergies to grass, which was a bummer because he played a lot of football. And these allergies is when your body recognizes the grass antigen on the cells on the grass as something bad that it needs to fight, right? That is a harmless thing. Peanut butter is harmless unless you're allergic to peanut butter, and then it's not. It can be lethal, right? So in this case, allergies are triggered by allergens like pollen. It could be bee stings. Maybe you have to carry an EpiPen around. Peanuts. Sometimes people are allergic to an antibiotic like penicillin. And you can have an immediate response, which occurs within seconds. You're in a room and like, oh my gosh, who has peanuts in this room? And they start having an immediate allergic response. Very common cold-like symptoms, because what is it triggering? It's triggering your inflammatory response, right? That's swelling. Remember, we talked about histamine. It can actually lead, in some cases, to anaphylactic shock. So anaphylactic shock is characterized by a sudden life-threatening drop in blood pressure, because you're dilating all your blood vessels, and so the blood spread everywhere throughout your body and your blood pressure drops, right? Remember, we talked about vasodilation. Also, you could have a delayed response to it. So a delayed response is like you're exposed to poison ivy or poison oak, and it shows up over the course of several hours. So this is initiated by memory cells, and that's why sometimes when one person has an exposure to it the second time, because they have memory cells, it's even a larger response. Maybe you have a pair of earrings that if you wear them, they irritate your ears by the end of the day, and you have to like yank them out of your ear because it feels bad. And then the next time you put them on, it's even worse. Just a little tip for you on that. Those are cheap earrings, but they could be really super cute. So sometimes what I'll do, if I have a pair that I know starts to irritate me by the end of the day, I put a little Neosporin or a little chapstick, if that's what I have, and coat the metal and then put it in my ear so that there is that slight barrier between the metal and my ear. All right. So this response is regulated by cytokine. An example would be things like TB tests, poison ivy, and cheap jewelry. Sometimes they're really cute. All right. Now, blood type reactions. You will attack any blood that has antigens different from yours. So for instance, I have type A blood. So if somebody gave me type B blood, I would attack it, right? Now, if somebody gave me a B blood, it's not the A antigen I would attack. In this case, it would be the B antigen. And if you've heard of O positive, O negative, A positive. That positive is if you have the Rh antigen in addition. So this would be AB positive, right? Because it has the A antigen, the B antigen, and the Rh antigen. O negative would have none of these three things. And that's why O negative is a universal donor. It has no antigens to make somebody's immune system upset, right? But the thing is, if you are O blood, then you can only receive O blood because you would attack A blood, B blood, and definitely AB blood. So blood type reactions, you attack any blood that you can build antibodies against, So here's just a little chart, okay? So you can donate blood to anyone who won't attack the blood that you give them, right? So type A blood has A antigens, and they will make anti-B antibodies, right? B will make anti-A antibodies. AB will make none, right? So that's why somebody who's, let's say, AB positive, you can give them any blood you want. And O blood will make both anti-A and anti-B antibodies, okay? And then what happens when you have those antibodies, remember we looked at that, and it's specifically immunoglobulin M or antibody M, and it causes that clumping. And that clumping, say in a capillary, right, that could cause a stroke, that's bad. So that causes death. Now, truth be told, the first time you get blood, you could get anybody's blood because it takes time to build up those memory cells. But the second time it will respond really quick and just kill you. Okay, so that's why you don't do that. So tissue rejection. So let's say you need a kidney, okay? You need a kidney in order to survive, right? You're undergoing dialysis. If this kidney is not from your body, it's from somebody else's body, and they are donating it to you, this is a foreign substance. Your body will attack it. And that's why some organ donations only last, or they predict like it will last 5 years, it will last 3 years, because you can only hold back your immune system so long before it will attack it. And you have to take immunosuppressant drugs, trying to suppress your immune system so that you don't attack this foreign tissue. But that makes you at risk to get something else if you're suppressing your immune system. So tissue rejection can be prevented for some time with administration of immunosuppressant drugs. All right, so then let's talk about some disorders of the immune system, some autoimmune diseases, for instance. So autoimmune diseases, remember we needed to learn self from non-self, right? And we talked about T cells who do cell-to-cell combat, and remember T cells mature in the thymus gland, and they need to learn like the cells you were born with, don't attack these cells because they belong to you. And you want them to know something other than you as being foreign and attack it. But in autoimmune diseases, you are attacking your own tissues and you're thinking that it is foreign. So for instance, lupus, it could be, in your joints that you could have lupus, or it could attack your kidneys or the membrane of your lung, your pleura, or your heart. And so you get inflammation and swelling, and you have to drain that inflammatory fluid off. So that is a really hard disease to have to deal with. So it results underneath disorders 13.5. It results when cytotoxic T cells or antibodies mistakenly attack the body's own cells as if they have foreign antigens. So the cause is unknown, but sometimes appears following recovery from some infection, that somehow your immune system, when it goes through a hard infection, it's like, wait, I'm confused, and starts attacking our own cells. Some examples of that would be multiple sclerosis, where you attack the myelin sheath of your neurons, your nerve cells. That would be you attack this right here. Okay, systemic lupus, rheumatic fever, diabetes, you're attacking your islets of Langerhans of your pancreas, and that would be juvenile or type 1 diabetes. If you're attacking that, that's one way to have it. And there are no cures when this happens. There are just, these diseases are controlled by drugs to try to lessen the symptoms of it. All right. And that, my friends, is the end. And if you are one of my students, I will see you in class.